Hi and welcome to Hoxton Therapy. This is a narration of one of our articles.
Mental health crisis in the UK during lockdown peak. Since the outbreak of the coronavirus lockdown in the UK, research has shown that the rate of depression and anxiety has tripled. According to the experts from the UK, Belgium and Austria, the world's most renowned mental health problems, depression and anxiety, have been found to have been dramatically increased in April this year compared to the former reports before the pandemic lockdown. Insomnia as a variable was investigated among the 1,006 respondents in the study. The response was analysed by scientists from the popular University of Sheffield. There was a little flaw in the study as it did not investigate the period shortly before the lockdown, but apparently this is because the pandemic severity and lockdown were not anticipated. However, the data gathered from the study was measured against existing prevailing data reports. About 52% of the participants reported high prevalence of mental illness. It is important to note that before the lockdown, statistics showed that there was only a 17% prevalence rate of mental health disorders. And with the present state of research, it clearly shows that there is more than 300% rate of mental illnesses. Furthermore, among the respondents, only 28% reported having insomnia. A meta-analysis of research on insomnia across Europe before the pandemic was, however, 7%. Analysis further showed that women, adult participants below the age of 35 years, low-income earners, and those who were unemployed reported experiencing severe states of mental problems. Participants who are socioeconomically disadvantaged also reported having severe mental health problems too. A scientist from the University of Sheffield, Dr. Jamie D'Angelo, noted that the current result calls for attention to look into the mental health issues facing the country. From time memorial, it is clear that the mental health sector in the UK has suffered from lack of funding, and this has shown that the debilitating effect of mental health conditions of people. The result hence shows the need for health services to be provided and the UK policymakers to consider the mental health state of teeming populations in a time like this. Support by a statement made by Michael Barkham, who is a professor of clinical psychology at the University of Sheffield. The tripled increase found out in the results clearly depicts the high correlation between COVID-19 pandemic and the mental health crisis like depression and anxiety. The findings did not establish a causal relationship or effect, hence further study is recommended to establish that, the study suggests. NHS Mental Health Director Claire Murdoch stated that the COVID-19 pandemic would have significantly impaired the mental health of people, at least since the lockdown began, but taking certain steps could help ease the symptoms you're experiencing. Among the steps suggested are regular exercise, healthy diet, talking to friends, colleagues and loved ones. According to the NHS director, people can make good use of the accredited self-help online platforms such as Every Mind Matters if they are experiencing a tough time. If the problems persist, the NHS is available to provide online support as well as in-person appointments. Added also are video conferencing and hotline calls, all to give the support everyone needs.
Never act on any advice given in these articles, videos or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.